All right, good morning, and thank you for joining us today for the Council of UC Staff Assembly's Fall Quarter All-Staff Town Hall. My name is Greta Carlalay, and I am the chair of CUCSA. I work at UC Santa Barbara, and I have 32 years of service. If you're not familiar with CUCSA, we're an assembly of volunteer staff dedicated to improving communications between UC administrators and staff. CUCSA's objective has been to provide service to the university by advising and providing a staff perspective to decision makers. Seen in this photo here, CUCSA consists of two delegates from each UC campus, Agriculture and Natural Resources, Berkeley National Lab, and the Office of the President. We act in the interests of all UC staff, particularly non-represented staff, whose relationship with the university is governed by policy rather than collective bargaining agreements. Today, our town hall will feature members of the Benefits Program and Strategy team at the Office of the President. Open enrollment begins on October 30th, and in preparation for that, we will begin with a brief overview about the changes that you will see to the UC benefits package. Then the rest of our time will be spent on Q&A, followed by a brief closing just before noon. We are recording this session and will post it to our YouTube for those who are unable to join us. The link to the recording will be posted on our website and sent via social media and our newsletter. To begin, let us acknowledge the land where we work, live, and play. The Council of UC Staff Assemblies recognizes that our service occurs on the unceded territory of the Indigenous peoples of California, and that these lands were and continue to be of great importance to them. Every member of our community has and continues to benefit from the use and stewardship of these lands. With respect and gratitude, we acknowledge and make visible our relationship to the original caretakers. Since our last quarterly town hall in July, the 2024-25 CUCSA leadership presented the CUCSA year-end report to the regents. The link to the recorded presentation, as well as a link to our recommendations, are being posted in the chat. The 25-26 delegation met in person for the first time in Salinas in September for our summer meeting, hosted by Agriculture and Natural Resources. For more information about this meeting, see the link to our meeting summary notes in the chat. This year's work groups include a continuation of sustainable workforce and well-being work groups. We also have an engagement and community work group. You can read more about the work group charges in the document linked in the chat. And I will now turn it over to Dre.
Hi, everyone. This is Andrea. I also go by Dre. I'm this year's chair-elect, and I currently work for UCSF Health. I have 15 years of service at University of California, having previously worked at UC Davis and UC Santa Cruz. I'm glad to be with you all here today. CUCSA offers these quarterly town halls as an intentional creation of opportunities for meaningful two-way communication between non-represented staff and leadership. This came out of an informal questionnaire that one of our 2023-2024 work groups conducted, which reflected that many of the non-represented staff that they heard from expressed a sense that lines of communication between staff and leaders across all levels were weaker than before the pandemic and felt less transparent and authentic. They felt improved communication would help build connection to their locations and to the UC, and also help staff feel more seen and included. CUCSA is pleased to feature members of the Benefits Program and Strategy team from UCOP's Systemwide Human Resources today to highlight the 2026 open enrollment process and changes to this year's benefits offerings. At the conclusion of this presentation, we'll begin with some selected questions that you submitted with your webinar registrations. And then if you'd like to ask a question during the town hall, please type your question using the Q&A button in Zoom. And the benefits team will provide typed answers to some of these questions. And if time allows, we may answer some in the webinar discussion as well. And I will now pass it over to our benefits team. Thank you so much for being here today.
Thank you so much, Dre, and to Greta and the CUCSA team for having us today. We want to go over some preparation for open enrollment coming up and have some time to answer your questions as well. And Greta, thank you as well for inviting me and my team down to Salinas to engage CUCSA leadership recently on some of these changes and preparing us for this meeting with all of your constituents. So really nice to be here today. I'll cover some additional items and then we'll really get into some of the meat of 2026 open enrollment. The next slide has a really brief agenda for us, but today I and my team will cover initially the UC strategy for stability. As some of you may know, we've had some challenges with our benefits plans and pricing and had become, somewhat unaffordable in terms of what other employers like us charge on the market. And we'll talk about what we've done to stabilize our program and even more importantly, what's new for 2026 and make sure you're all armed with open enrollment information and have the ability to ask any questions here. And if we're not able to get to all questions, we'll work with CUCSA leadership to use the remaining Q&A and make sure we're publishing them for you after the seminar is concluded. The next slide has a brief overview on our strategy for stability. And as you can imagine, we're trying to solve a financial challenge of affordability, and yet the plans themselves in aggregate across all plans, Kaiser and Blue and Gold and the PPOs came in an aggregate of over 10% to begin with. So just think about trying to find any money to solve a financial problem in a year where your inflation, out of the gate has to be paid for at over 10%. And at the same time, as all you know, we've had a lot of impacts to our funding sources as an institution globally, a lot going on with the federal government and our research grants and these types of things. So it's even a more challenging environment to solve for a financial challenge with all the impacts to us financially as a system. But I'm pleased to be able to report that we've worked with finance to make a net investment in our program this year. It's additional $260 million in medical benefits for a total investment on an annual spend of about $3 billion for the active benefits plan, setting aside retirees. That 2.6 is about a 9.5% increase for finance's budget. And just to help put that in context for all of you, 2 years ago, the budget was 4%. We asked them to increase that by 50% for 2025, so it went to 6%. So 9.5 is about double what the university has typically invested, and it was not planned. We're just trying to help stabilize the program and reinvest for affordability for all of the employees. The good news is on a net aggregate basis, if you will, that means the university will now cover, it says 83, it's actually 83.4% of the employer subsidy on the premiums for this coming year, 2026. That compares to 82.2 in 2025. So the university will actually cover a higher percentage of all the plans in aggregate, for the next year. But there are swings in terms of prices. So there are people that will actually have cheaper plans than they had in 2025, and other people in certain plans that will have more expensive plans. So there's a lot of variation as we implement a new pricing methodology called a portfolio rating, which I'll talk about a little bit here. The good news is too, UC will continue to provide 100% fully paid insurance coverage for the dental plan. And we'll talk a little bit about some enhancements to the dental plan because of some challenges maintaining dentists in the network. And then also, I just want to acknowledge UC Health. So finance did a lot of the heavy lifting here that led to the increased investment chart you see on the right. But our academic medical centers also tightened the belt and really chipped in. If you don't know, we get what we call a friends and family discount from our own providers, for our PPOs and Blue and Gold by UC Health itself, the 5 academic medical center campuses, plus Riverside's actually coming online with some medical services as well. And UC Health combined has committed to a 1% unit cost increase between 2025 charges to our plans and 2026. So if you think about 10.2% being the inflation rate, UC Health has also absorbed a lot in helping to solve for our financial challenges to make plans more affordable for all employees in our programs. The next slide has some other high-level elements as it relates to stability. We've decided to make the tough decision to think about core and HSP and come up with a new iteration with a new plan called Health Savings Plus. It is a high deductible health plan offer that is replacing both core and HSP. Moving forward, it'll be our lowest cost leader. So we actually looked at this, and I know core and HSP struggled from a pricing perspective, respectively, and I think we have a good solution now for 2026 that is kind of the right price for the right level of coverage. It sort of matches more of a high deductible level of coverage and will be more of a low cost leader. And it also has the HSA seed money up front as an investment that's higher than the traditional HSP seed money. And we'll go into some detail when we get to that section of the presentation as well. I mentioned the new premium structure briefly, but this is a new methodology really rating our plans together as a portfolio in a method that achieves more alignment in terms of what the plans cover and what the prices are for those plans compared to our old methodology that was utilized to cover plans. However, it does mean that there's going to be changes in prices that can be significant compared to 2025, both positive, it's almost unheard of to have, a negative price reduction on your health benefits, but a lot of people enrolled in our plans will experience a price improvement in 2026, and others will have an increase in price based on that new methodology. Major contribution adjustments are really to help us stabilize our pricing approach. And year after year, starting in 2027, all plans will start to flow more evenly along the lines of medical inflation rather than wide variation in pricing or prices that are less connected to the actual coverage a plan provides. There are some significant changes this year, particularly for Kaiser premiums. We're going to start subsidizing Kaiser equally to Blue and Gold on a percentage basis. And if I compare that to the history, Kaiser had been subsidized more as a percentage than Blue and Gold. And so some of the impacts as a result will be that the Kaiser prices from a general perspective could be higher. We are gaining a bit more control over the variation in our costs with this methodology, but it's a significant shift to go from a lot of variation into a new approach. And so 2026 is going to be a year of change. And then again, that'll follow with 27 and 28. That'll seem more like lockstep inflation over the 2026 rates themselves. We process these changes with a bit of philosophy on our next slide that really considered, aspirations for both, a more equitable programs and pricing, frankly, more marketable, where we were more like other big institutions in terms of what we would charge for a PPO compared to an HMO or a high deductible health plan, and something that's more sustainable over time. We'd almost just been tweaking the old methodology because it didn't seem to produce rates that were implementable the last few years. And this is a real solution starting in 2026 that, again, is going to be a big change, but that'll stabilize us for the years thereafter in something that seems more connected to the actual coverage and designs of our plans themselves. One big call out is we will continue to provide subsidies. That pay band methodology will not change. That's the sort of big blue banner at the top. We'll see impacts to all pay bands, both positive and negative, but we want to maintain that important philosophy so that the highest wage earners are subsidizing the lower wage earners in the lower bands overall. And then finally, on the next slide, I think we'll get into some of the detail. I'll introduce Irene Dorsey from our benefits team, who will go over some of the details in these changes, and we'll again answer some of your questions before we conclude today as well. Irene?
Thank you, Maynard. Good morning, everybody. As Maynard said, I want to go over the changes of the medical plan, and I'll transition it to my colleague Priscilla Wong for the non-medical plans. So this slide just illustrates a snapshot of the plans in our non-Medicare portfolio for 2026. You see Blue and Gold HMO, Kaiser Permanente, California HMO, and UC Care are our current plans that will continue into next year. As Maynard mentioned, Health Savings Plus and Kaiser Permanente Mid-Atlantic HMO are two new plans. And I'll go a little bit more into detail about what those plans look like next year. So two significant changes that we're making. The first here is that, and you all are likely know about this already because information has been shared out, but Anthem Blue Cross is going to be transitioned out and replaced by Blue Shield of California for our claims administration, utilization management, and provider network. Accolade remains member service, care advocacy, and virtual care vendor. Win Fertility will also remain as our infertility benefits vendor, and there will be some process changes, which I'll go over in just a couple slides. Navitus will also remain as our pharmacy benefit manager, or PBM, for the PPO plans. Maynard touched on the new Health Savings Plus plan. It's a new HDHP, replacing core and HSP. It will be UC's lowest premium medical plan. It is also compatible and comes with a health savings account that UC will seed. And I'll share a little bit more detail about what that plan looks like compared to our current core and HSP plans. Health Equity will also remain as our HSA custodian. So if you're a current HSP member, you will retain your account and there won't be anything that you need to do in terms of that transition. I do want to note that you are not eligible to enroll in Health Savings Plus if you are already enrolled in Medicare, are in a split family enrollment where at least one member of your family is in Medicare, or you plan to enroll in UC's flexible spending account. Next slide, please. On the next slide, we illustrate here the differences between our current HSP and core plans compared to the new HS Plus. So you will see that there is higher seed money from UC that will go into your HSA at $750 for an individual, up from $500 currently in HSP, and $1,500 for a family, which is an increase from $1,000 for family coverage in HSP. The in-network deductible is higher than HSP, but lower than core, while the out-of-pocket max is slightly higher than core. The coinsurance for normal visits is at 30%, is higher than both plans. The out-of-network is also at 50%. The HSA contribution limits are imposed by the IRS. Those are going up by $100 for single coverage and by $200 for family coverage to $4,400 and $8,750 respectively. The catch-up contribution will also remain at $1,000, which is a current catch-up contribution limit for members 55 and over. One enhancement I wanted to highlight here that is changing compared to HSP is coverage internationally through Blue Cross Blue Shield Global Core. So currently, members of HSP, when they travel outside of the United States, are only able to get urgent or emergent care at 20% after their deductible. Next year in HS Plus, members will be able to access standard routine care at a 30% coinsurance. On the next slide, I want to illustrate a little bit on the changes that are going to be effective for the infertility benefits. I do want to note that there are no changes to the actual benefit coverage for HS Plus and UC Care. So the current benefit levels for infertility will carry over into next year. However, the change in administrators from Anthem Blue Cross to Blue Shield of California does change how Win Fertility and members use Win Fertility. So you'll see here that currently members who are using our infertility benefits use Anthem's network of providers, and they also have their claims processed by Anthem. They also get their infertility drugs through the Navitus pharmacy. Next year, members will use Win Fertility's network of providers and have their claims processed by Blue Shield, and they will also use Win Fertility's pharmacies, which are mail order RX only. On the next slide, we just talk a little bit about a new program that's going to be implemented in UC Care and Health Savings Plus called Access Guidance Services. It's a manufacturer copay assistance program through Navitus that changes how out-of-pocket costs accrue to the annual deductible and out-of-pocket max. So currently, any savings that you receive from using a copay card on specialty drugs, HIV drugs, GLP-1s, high-cost medications, currently accrue to your out-of-pocket maximum. With the implementation of this program, the savings from those copay cards will no longer be applied to the deductible and out-of-pocket max. So only your true out-of-pocket expenses and costs will apply to the out-of-pocket max and deductibles. The next slide will illustrate a couple of other enhancements that are being made to the travel expense benefits for surgeries. Currently for transplant, bariatric surgery, gender affirmation surgery, and gene therapy, and actually, sorry, not for gene therapy, but for the preceding 3 surgeries, there is a $50 per night per person limit on lodging and no allowance for food. And so in next year, those 3 surgeries, as well as gene therapy and for ocular disorder, will have a lodging expense that increases to $250 per night per person and a food allowance of $150 per day per person. And on the next slide, we just illustrate a few new travel vaccines that will be implemented for UC Care and HS Plus. Okay, next slide, please. I'll transition now into our HMO plans. There are a number of legislative mandates that are going to be implemented in both UC Blue and Gold and Kaiser. Some of them are already effective and claims are already being processed under some of these new mandates, but they will be visible and referenceable in your plan document starting 1/1/26. So one significant change that's being made in both Blue and Gold and Kaiser is a result of SB 729, which is coverage for diagnosis and treatment of infertility. This requirement requires that fully insured large group health plans based in California provide coverage for the diagnosis and treatment of infertility. And we know that UC's plans already cover both the diagnosis and treatment and IVF, GIFT, and ZIFT. However, this mandate does expand our coverage. So currently with these 2 plans, we have IUI, IVF, GIFT, and ZIFT covered at 50% coinsurance. And then for IVF, GIFT, and ZIFT, we have an up to 2 cycle lifetime limit per member. Prescription drugs are also covered at 50% coinsurance, and none of the services under the infertility benefits apply to the annual out-of-pocket maximum. Next year, all the infertility services will be available at plan-specific cost shares. So what that means is that instead of paying 50% for each procedure, you will be paying for office visits. So if you're getting procedures done in an office visit setting, you will pay the applicable office visit copay. If you're getting an outpatient surgery, you'll pay the applicable outpatient surgery copay or coinsurance. Additionally, it also expands the coverage for IVF, GIFT, and ZIFT to up to 3 completed oocyte retrievals per lifetime and unlimited embryo transfers per member. Prescriptions are also covered at the respective pharmacy tier level instead of at the 50%. It also applies to the annual out-of-pocket max. So not only will members pay less for the services next year, they will likely pay less for all services since these services would apply to the out-of-pocket maximum. It is important to note too that this allowance restarts. So if a member has used their 2 cycles in either one of these plans, they actually are eligible to access the up to 3 completed oocyte retrievals as well. The next slide illustrates 2 other mandates that are actually already implemented in both of these plans, but weren't shared at Open Enrollment last year because of the timing of when they were passed. Assembly Bill 3059 for human milk essentially adds medically necessary pasteurized human donor milk obtained from a licensed tissue bank as a basic healthcare service. So it ensures access to to the human milk, which avoids some of the barriers that were there and that were there for members previously. It also simplifies the process for hospitals to distribute the donor milk by removing certain regulatory hurdles. APL 20026, the Children and Youth Behavioral Health Initiative, is actually implemented already for Kaiser. This actually just essentially ensures that if child or a student up to age 25 accesses behavioral health or mental health services in a school setting, that the insurance plan can be built and will pay for those services. On the next slide is Assembly Bill 2843, healthcare coverage for rape and sexual assault. Next slide, please. Okay, thank you. And this bill essentially requires that health plans and health insurers provide coverage for individuals who have been a victim of sexual assault or rape for up to 9 months after their incident. It provides coverage at no cost for a number of services ranging from urgent, emergent, follow-up care, mental health care, acupuncture, chiropractic care, prescription medication, et cetera. It also prohibits the health plan from requiring, as a condition of providing the coverage, that the individual file a police report, that they bring charges against their assailant, or that the assailant be convicted. Next slide, please. I did want to share, because you will see information about this in your open enrollment materials, about a new plan that we are implementing that is only for our Washington Center employees based in Washington, D.C. This is our Kaiser Mid-Atlantic HMO plan. This plan was built to mirror as closely as possible our current Kaiser California plan. There are some differences, mostly because of the mandates and the laws are different in California and the Mid-Atlantic region. So this slide just quickly highlights some of the differences between our Kaiser California plan and the KP Mid-Atlantic plan. Next slide, please. All right, so one change that you will hear about in our open enrollment communications is to our weight loss medication criteria. And we're making this change across all of our non-Medicare medical plans. Each plan is slightly different in how they are managing the members on these drugs, so there is some variation. You know, the best thing is to probably reach out to your plan or look at your plan documents to get more details. But I did want to highlight some of the differences here and how this will look and work next year. So next year for UC Blue and Gold, the requirement will be for a BMI or body mass index of 40 or higher for new prescriptions. There won't be any exceptions for comorbidities. Current utilizers, however, can continue to use their drugs into next year, even if their BMI is under 40, if their provider deems it medically necessary to do so. They would also have to ensure that they meet the prior authorization criteria that is set forth by Health Net. For Kaiser, it's a little bit different. So for Kaiser members, we are removing that criteria for members who have a BMI of 40 and under. So if you have a BMI of 40 and under with no other comorbidity, you will not have access to your medications. And you will only have it if you have a BMI of 40 or higher, or if you have a comorbidity that's listed here in this chart. So a BMI of 30 plus with moderate or severe obstructive sleep apnea, or a BMI of 27 and plus with either peripheral artery disease, history of stroke, or heart attack. So next year for Kaiser, you will be able to continue to use your weight loss medications if you started your treatment at a BMI of 40 or higher. However, if you started your treatment at a BMI less than 40, you would not have access to those medications next year. For UC Care and Health Savings Plus, the criteria is very similar to UC Blue and Gold in that the BMI requirement is 40 or higher for new prescriptions with no exceptions for comorbidities. However, for next year, their continuation is similar to Kaiser in that members can continue to use their medications if they started their treatment at a BMI of 40 plus. So I know that can be a little confusing. It is, again, different for each plan. One thing I did want to call out is that this does not change the coverage for GLP-1s for type 2 diabetes. So members who are using a GLP-1 drug for type 2 diabetes as their primary condition are not impacted by this change. Right, next slide. From an operational perspective, we just wanted to share what ID cards would look like for next year. So for Kaiser members, only new members will receive an ID card. So if you're a current member of Kaiser, you will not receive a new ID card next year. However, all UC Blue and Gold members will receive new ID cards, and they actually issue new ID cards every year. For the Health Savings Plus and UC Care plans, all members will receive one card for both medical and pharmacy. And for Health Savings Plus members, if you are a new Health Savings Plus member, you will receive an HSA card from Health Equity. However, current HSP members will continue to use their current card. Okay, I will now transition it to my colleague, Priscilla Wong.
Hey, thank you, Irene. Hi, everyone. I will go over with everyone the non-medical plan changes, as well as some general open enrollment information and resources available to you. First, let's start with the dental plan changes for 2026. But I'll start with we did do earlier this year, UC completed a dental administrator review. Through the review process, we did learn that the dental provider retention issue is actually a industry trend, which is experienced by all dental administrators. It's not just Delta Dental. What we found is many dentists have discontinued their contracts with all dental administrators and have chosen to go independent. And through the review, we did find that Delta Dental continues to be the largest provider, have the largest provider network. And switching away from Delta Dental would have caused network provider disruption for 20% or 80,000 UC members. So the review committee decided to stay with Delta Dental. UC does recognize that the dentist termination impacts many UC members. And to help member who can't find an in-network provider, the dental PPO plan coverage will be increasing from 75% to 80% of allowed amount for services listed on the right. These services include sealant benefit, root canal, gum disease, oral surgery. The increases are to Delta Dental Premier providers and out-of-network providers. Next slide. And other plan changes for 2026 include an enhancement to the hospital indemnity plan. The hospital admission observation requirement is decreasing from 24 hours to 18 hours. And the 2026 flexible spending account annual maximum for health expenses will be $3,300. Dependent care flexible spending account will be $7,500. And for those that have salary of $160,000 or more in 2025, the dependent care FSA annual limit will be $3,200. And this is due to the non-discrimination testing requirements. Okay, next slide. And in terms of the employee contribution for the non-medical plan, as Maynard had mentioned, the dental and vision plan will continue to be funded at 100% by UC, and this includes employees and their eligible dependents that are enrolled in the plans. There are no rate changes to hospital indemnity, critical illness, accident, and legal insurance. Plans with rate changes include supplemental employee life insurance with a decrease of 8%, and accidental death and dismemberment will be increased by 10%. Next slide. Next, I want to go over some general open enrollment information in preparation for open enrollment. This year, open enrollment begins on Thursday, October 30th at 8 a.m. and closes Friday, November 21st at 5 p.m. Pacific time. Plans that are available for open enrollment includes medical, dental, vision, legal insurance, accident, critical illness, hospital indemnity, both health and dependent care FSA, and the health saving account contribution as well. That is if you are enrolled in the Health Savings Plus plan. Next slide. And some additional information to note. If you do not make any changes during open enrollment, your current enrollment will carry forward to 2026 plan year. That is with an exception of the flexible spending account. The health FSA and dependent care FSA must be elected every year. Also, an important note about your medical plan, as shared by Irene, if you are currently enrolled in core or health savings plan, you are automatically enrolled in the Health Savings Plus plan for 2026. That is unless you go in and make changes during open enrollment. Changes made during open enrollment will go into effect January 1st of 2026. There are some benefits plans that are handled outside of open enrollment. That means you can enroll at any time during the year. They include supplemental life insurance, voluntary short-term and long-term disability, accidental death and dismemberment, and pet insurance. There are also some benefits that you already have that does not require any enrollment. You are already enrolled in them. They are the identity theft protection and adoption assistance. Next slide. Next, I'll go over some enhancement in ALEKS. ALEKS is a benefit decision support tool that generates customized, personalized guidance for selection of health and welfare benefits. ALEKS provides user with medical plan premium specific to their personal situation, including location, pay band, and union membership. And what's new for next year, for this year's open enrollment, the user may search for their preferred healthcare provider. So you can enter the name of the providers that you are using, and ALEKS will help indicate whether or not that provider is in network for medical plans that ALEKS suggests. If the user provides their name, date of birth, and the health plan ID number, ALEKS will now show the user's medical spend so far for the year. And this will be helpful for planning which medical plan is best for you. And ALEKS also takes the user's risk tolerance into account when suggesting which plan are the best fit for them. So the user can have the option to indicate if they want to pay more in premium or they want to pay more when they use their services. And employees and their family member who lives outside of the service area for the medical HMO plans, which is determined by the zip code you enter as a user when you're in ALEKS. Kaiser and UC Blue and Gold are our two HMO plan. If you enter a zip code that is not eligible for these two plans, they will not show as options in ALEKS. And the remaining three bullets are reminders about ALEKS. So again, ALEKS provides guidance based on the user's input. So what you input into ALEKS, it will help with determining how ALEKS will guide you. It provides information about, the UC faculty and staff health and welfare benefit, not just medical. So all your dental, vision, critical illness, so all the benefit plans that I mentioned previously is in ALEKS as well. So it can provide you guidance and education on those benefits as well. And ALEKS has the option of the auto LED or text-based LED. So it can speak to you if you choose that, or you can read the information yourself. So you have that option to choose. Spanish is also available in a text-based option. Okay, next slide. And here are some resources I want to share with you that you can utilize and get more information about open enrollment, the plan changes, as well as rates. So UCnet, we are designing an open enrollment website for you that will include 2026 updates, and that will begin on Monday, October 27th. As I mentioned, Alex is also available to you, and that will be live and open with 2026 information on October 29th. There will be brochures that will be mailed to your home with the expected arrival in the week of October 26th. So employees should look out for also local, virtual, or in-person open enrollment events as well. So look out for that information from your location benefits team. During open enrollment, UC Path will also provide various emails to help guide you as well. So reminders, things like that. So be sure to open your email from UC Path. And this concludes our presentation. I will now hand it back to, I think, Greta or Drew.
Thank you so much,
Dre,
Priscilla.
sorry, Dre.
Thanks, Priscilla. Hi, everyone. This is Andrea or Dre. Thank you again to the Benefits Programs and Strategy team for your extensive presentation. So we'll now start with some of the questions submitted during registration. Can you please explain the timing of the releasing of the information about these specific changes to the plans as well as the cost of the plans?
Thank you, Dre. I'll go ahead and take that one. And some of my teammates may join here as panelists as well for your Q&A session. As it relates to timing, as you can imagine, we have a lot of experience in a plan year, and it takes a few months after the end of the plan year. So for last year's performance, it was like February or March before we really saw the full solid year of utilization in the plans. And that really gives us an estimate of sort of what was and how we forecast, what will be for the following year, 2026 in this case. And from that moment, we start working with finance and UC Health, as I mentioned, to really solve for employee contributions and affordability. And the timing between, when we know what the experience is and what the next year will look like from an inflation perspective, we really spent the next couple of months there finalizing the budget. And as I mentioned, UC is about doubled the budget and increased the overall employer subsidy this year to 83.4%, which is up from 82.2 in 2025. And that brought us right into, July or so. And we had to make some tough decisions around, the plan portfolio. And with HSP and Core, as you know, we just decided to replace that with a new high deductible health plan, low cost solution as an alternative. So we had to design that and cost that and get it ready. So that really led us to, starting to define contribution rates, after August. And it's been a bit of a rush, frankly, to get ready for open enrollment. But that gives you a sense of the annual cycle itself, how everything is really predicted based on a full year of plan experience, which takes, a few months into the next year to evaluate. And then we make some design choices to make things as valuable as possible. We try to minimize changes that are takeaways like copays or deductibles and that sort of thing. And as you've seen in this new coming year, we really didn't make changes at all as it relates to your copay out of, when you get to the office at the point of care. So anyway, we've minimized a lot of changes for 2026. I think the big one is this sort of new methodology on how we're pricing our plans, more so based on the coverage and what they call the actuarial value of each plan's design and what it covers. And I think our portfolio in 2026 will be more in line with the market of other employers like us and what they charge for similar plans.
Thanks, Maynard. And you started to touch on this, but our second question is, why are premiums increasing for most members of the Kaiser HMO?
That's a great question. Thank you, Dre, and thank you to the CUCSA audience here for submitting that. It's just a coincidence of time and the previous methodology. I started here about a year and a half ago, and one of my big aha experiences as a new leader over benefits was some of these plans are like double, almost 2.5 times what I would expect an employer to charge for a given plan or a given coverage level. So we started with just asking ourselves, where do we fit in this market compared to those other employers? And indeed, we found that we were pricing our Kaiser plan almost as a market leader, with the employer subsidy being extremely high compared to some of the other plans. And as I mentioned, moving forward in 2026, we made the tough decision that we're going to price Kaiser and Blue and Gold with an equal subsidy as a percentage from the university. Kaiser will still be cheaper than Blue and Gold in most coverage categories, almost universally, because its plan cost out of the gate is cheaper in terms of what Kaiser charges us. But we've created more of a level playing field where Kaiser will get the equal percentage of UC's subsidy as Blue and Gold will. And so the two plans can really compete side by side. And Blue and Gold could become less expensive than Kaiser if cost structure is adjusted and the Blue and Gold price is cheaper than Kaiser's insurance rate price. So, but that really explains like where we've been and why it requires an increase to the Kaiser prices based on that equal subsidy, where we perhaps have over subsidized Kaiser as a plan compared to the others in the past.
Thanks so much. So, given all these changes that you've presented today, how can I decide which medical plan makes the most sense for me and my family?
I can answer that, Dre.
Great. Thanks, Irene.
Yeah, no problem. As Priscilla mentioned, there are a number of resources that will be released very, very soon. The OE brochures are hitting the mail this week, so they'll be in your homes. You should receive those early next week. The open enrollment site goes live on Monday, the 27th, so there'll be more information as such that we covered here on each of our plan pages and on the open enrollment website. So there'll be lots of information there to compare. There are also campus and med center benefits website. That's also a great resource as well. There will be local presentations, sometimes in person, sometimes via webinars that you can also tap into. There'll be smaller groups so that you can ask more questions, and those benefits experts can help there as well. And as Priscilla mentioned, Alex has also been enhanced this year. So that's also a great resource, taking in your own personal utilization and what your needs are to find out what plan's best for you.
Thanks, Irene. And can you go over again the new Health Savings Plus medical plan compared to Core and Health Savings Plus?
Sure. If we can bring the presentation back to that slide. Thank you, Erin. So as I mentioned, so the new Health Savings Plus plan is a high deductible health plan. So it is similar to HSP in that way. It does include an HSA account that UC also funds. And so you'll see here that the funding compared to the current HSP plan is increased. So it is a higher amount of subsidy or seed money, I should say, that's coming from the university. Whereas Core did not have an HSA compatibility or function to it. And you'll see here for the deductible in network for single and family is $2,500 and $5,000, which is slightly higher than the current HSP plan, but still lower than Core. And then for the out-of-network deductible for single family, it's $4,000 and $8,000. The out-of-pocket max, which is the most that you will spend in any particular calendar year, is $6,700 for a single individual in network and $13,400 for a family. That is higher than both plans, HSP and Core. And then you'll see here the out-of-pocket max for the out-of-network does align with our current HSP plan. The coinsurance is a bit different. So for in-network, out-of-network, you'll see in this, this row there, that is 20% and 40% for our current HSP plan, 20% in and out of network for Core, and that is different for our new HS Plus plan at 30% and 50%. And then the HSA contribution limit is a federal IRS limit, so that does change every year. And then, as I mentioned, the international travel benefit has been enhanced compared to the current HSP plan. So whereas our current HSP plan only allows for members to use benefits internationally for urgent and emergent care, that will be expanded to routine care outside of the country at a 30% coinsurance after the deductible.
Thank you so much. Again, another pre-registration question. Can you say more about the health savings account and why I might want to contribute to that account?
Yes, sure. So the health savings account is something, as I mentioned, that the university actually will contribute to on your behalf as well. And then you can also contribute that money. And that money is pre-tax. It lowers your taxable income. It's essentially a personal savings account. And it also lowers your out-of-pocket healthcare costs. So for every year that you enrolled if you were enrolled in HSP, if you're going to be enrolled in HS Plus, every year that you're enrolled in that plan, UC will contribute to that account on your behalf. And then you have those limits that, as I mentioned earlier, annually that you can contribute up to as well. And so those limits do include the UC seed money. The HSA allows you to pay for out-of-pocket healthcare expenses with those tax-free dollars. So you can use that money for qualified medical, behavioral health, dental, vision expenses for you and your dependents now or in the future. And then what makes it different from a flexible spending account is that you can take that money and it's yours to keep. So even if you leave the university, that's your money to keep. So that is essentially your personal account. And again, you can use that money to pay for deductibles, your co-insurance, prescription drugs, et cetera.
Outstanding. Thank you so much, Irene. We do have some additional questions from registration. These are regarding the dental plan. So some employee dentists have left Delta Dental, and you spoke to this a little bit in your presentation, but can you touch on again, how has UC considered other administrators?
Sure, absolutely. We did hear from many employees that their providers are leaving Delta Dental Network. And with that, we as I mentioned in the presentation, we did conduct a review to determine whether or not another administrator would better serve the UC community. What we found was that Delta Dental continues to be the best choice for UC. As I mentioned, changing administrator would have caused network provider disruption to about 80,000 members, and Delta Dental continues to have the largest network. And we are enhancing the dental PPO plan for 2026 to help members who can't find an in-network providers. And as I had shared, the Premier Network, as well as out-of-network coverages for some of the basic services are increasing from 75% to 80% coverage.
Great, thank you for speaking to that. Will Delta Dental continue to recruit new dentists into their network?
Yes, Delta Dental is committed to continue their recruitment effort. And in fact, they will be reaching out to some of the providers that have left their network and try to bring them back. And this is specific to UC members. They have agreed to do that.
Excellent. Thanks for that information. And then finally, from our registration questions, what resources are available to me if I have additional questions following the town hall?
Sure, I can help with that. Absolutely. I mean, this is very important. After this town hall, you may have more questions, and there are many resources available to you. I mentioned some already, and Irene also mentioned some. I would say start with UCnet. As I mentioned, we are building an open enrollment website on UCnet specific to open enrollment. And you will find information that we spoke of today and more. And there will be frequently asked questions in UCnet on that page as well. So that's good place to get more information. The UCnet Open Enrollment site will be live with 2026 information on Monday, October 22nd. However, if you want to learn more now, there is a great UCnet employee news article that was released on October 14th titled Big Changes, New Choices, 5 Things You Need to Know About Open Enrollment. So make sure you check out UCnet and take a look at that article because it's very informative.
Excellent.
If I can mention just a couple more things. So, there will be a brochure going home. So make sure you check out your mail coming from UC. Don't just toss it as good information, has resources where you can go for more information. And lastly, Irene mentioned this too. Make sure, check out your location because there are open enrollment events. Some are virtual, some are in person. So there are local healthcare facilitators as well as, benefits team to assist you with questions.
Excellent. Thank you again to your team. I see the Q&A chat has been really busy. Just want to point folks to the Q&A. You can see the team's answered over 132 questions today. So thank you to you and your team for answering those questions. I will now hand it over to Greta to wrap up our town hall.
Great, thanks very much. So Erin, if you could just stop sharing so that we can just pull up one last slide. I want to thank you for attending today's town hall. The video recording will be posted on CUCSA's YouTube shortly. We will also have answers to some of the Q&A, as many as we can get, that we will post on our website. You can stay connected with CUCSA by following us on social media, subscribe to our e-newsletter, access our YouTube channel, and more by going to our link tree. Thank you very much for joining us today, and thank you to the benefits team.
Thank you.